All right, here we go. Last lesson of the term. Don't cry. No. So yeah, this one's gonna be probably quicker than normal. I don't think we need to. There's a lot of good info here. I think most of us kind of know that a lot of this stuff already, but it will be good. It's about counseling children with disabilities. Um, Sometimes it can, when we talk about this, when we think about working with this population, it could bring up some anxiousness, some, concern, some, worried with new counselors trying to get it right or make sure they're doing everything okay. Especially because, when you're dealing with students with disabilities, whether it be an IEP or a 504 plan, which we're going to talk about, there's a lot of legalities that come in because each of those documents is a legal document and they're there for a reason, right? They're there to, you know, make sure we're leveling the playing field for these kids. So just know if as you get into your internship and start transitioning into, you know, putting on your big girl, big boy, big person pants, right? When you get your first job, like it's okay to be a little nervous because when working with children with disabilities, I mean, not just legally, there's that extra layer, but they need a little extra support. So we want to make sure we're doing everything in our power. And I think it's really just to understand that it's more than just knowing legally what these. And if I say, again, I use students and children interchangeably. Apologies in advance, but I think about my role. It's not just legally knowing what I'm supposed to do with these students, but it's also knowing ethically and just being a person what I need to do to support them. So it's not just the laws. Something important to keep in mind. So who are we talking about? We're talking about children that differ in physical learning or behavioral. Um, we want to create an LRE, the least restrictive environment. When possible, when we're looking at the school setting, and a lot of this is going to be focused on school, we want to try as best we can to keep them in general education whenever possible. But, I'm thinking about Buffalo Grove. We do have instructional classes, we do have classes that have a little more support, but when possible, we want to keep kids with their peers. Now, for those of you that go in the school setting, or those of you that even go in the private or community setting and are working with children, a lot of times this is going to be driven by their case manager at their school, which more often than not will be a special education teacher. Maybe in some instances it could be a psych social. In some instances it could be a counselor. The district I work in and my previous districts, it's always been either a special education teacher or, if it was someone in student services, it was a psych or a social worker. Um, but there are instances like I'm thinking of a student I had. I was supervising her practicum at NLU, and she was working at Metro, which is an alternative school, and she would write IEPs, and she was a case manager. Um, but like I know, like more and more counselors are becoming 504 case managers, so stuff you got to know as well. But the key statute was PL 94-142 in 1975. It guaranteed a free, appropriate public education for everyone. Um, there was a quote in our text that said, "The goal is meeting needs in the least restrictive environment and supporting families." So again, how do we not? I think it's all in the name, right? Least restrictive environment. Um, so now, we have the special ed, the IDEA, and the 504. So what are the differences? We got a couple of slides with those that we'll talk about, and then I'll give you kind of I have my quick quote that I use to kind of wrap my head around this. Sometimes I get a little pushback from people in the special ed world because it's a little too simple, and I agree, but it is also a good starting point. But first, if we're looking at the IDEA, educational remediation, and then a 504 or American Disabilities Association Act, preventing discrimination. One provides money, the other one gives no funding. One has an IEP, one has a 504 plan. Specialized instruction compared to accommodations, and then there are 14 specific categories. Or with a 504, it's a little broader. Um, Basically, with a 504 plan, you want there's a demonstrated either a disability, or there are instances where there is not a documented or diagnosed, that was the word I was looking for, disability. I have had one, not very often, but I've had ones in the past where the 504 plan has had to say, symptoms related to or symptoms similar to a diagnosis of, whatever you want to say there. But basically, with a 504 plan, there needs to be something that is impacting a major life function, and you need to see how it is impacting the educational environment. Doesn't happen often, but there have been times, believe it or not, when a student will come in with a diagnosis from a doctor, and they will say the student should have a 504 plan, and they say they should have these accommodations, blah, 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 blah. But then we look at the data, and we're not seeing any impact in the educational environment. So in those instances, sometimes we give students a 504 that's called protections only, which is they don't have any accommodations, but we say, yeah, there's a diagnosis and there's a reason for this 504 plan, but right now we're not seeing any need for accommodations to, again, for lack of a better term, level the playing field. But we keep it in there in case, as things happen, they are protected if it's something related to um, their disability, their diagnosis. So then I found this really cool diagram. I have two windows open right now, so I'm trying to have the presentation here, but then I'm also trying to have all my notes over here, and I'm trying to remember. There it is, where I pulled this up just because it's so small I can't see it in the presentation. All right, so key differences between IEP and 504. Went over a little bit. This one says meets one of the 13 IDEA. There's 14 now. Yeah, I mean, as you go through it, you see what's going on. Basically, my quick elevator pitch for the big difference between IEPs and 504s. Now, again, keep in mind, I have to give this disclaimer saying it is not as cut and dry as I'm about to say, but I think this does a good job of giving us a starting point. Is IEPs are modifications to the learning environment. 504s are accommodations to the learning environment. Now, what do I mean by that? If a student has an IEP, there is some sort of modification to the learning environment. So even with my students who have IEP plans and are in AP and dual credit classes, usually for their study hall, they have this class called Strategies for Learning, which is our supported special education study hall. So it's I don't know how to say it, but it's different from a general ed student. Whereas a 504 plan, everything is the same with a general ed student, except they have some accommodation. So it might be, hey, this student can be in the general education setting 100% of the time, but they have preferential seating, or they have extended time, or they're allowed to take breaks as needed, things like that. And actually, with 504 plans, it's kind of, for lack of a better term, these are the accommodations, and except with like standardized testing, if they get like ACT, College Board, AP tests, things like that, they really get to decide if and when they use their accommodations, which is a little different than an IEP where it's kind of like, hey, this is the setting, this is what we're doing. I have some students where we revisit the 504 every year, and that's something we'll talk about, like what the process looks like, and we'll look at different accommodations. And you know, I'll have a student that maybe we'll just go with the extended time on a test, and I'll say they'll think about getting rid of it. And I say, okay, between now, let's say the meeting is, December 1st, and our annual review is going to be next December 1st. And I say, okay, do you think between now and December 1st, can you imagine any class, any subject where you think at least once you might use this extended time? And if they're like, well, yeah, maybe once, then I strongly encourage them to leave it, just in case. Whereas if they're like, no, I'll never use it, then we might look at removing it. So 504, I mean, so that's one way to look at it, right? Modification versus accommodation. The other way you could look at it is, um, I just had a brain fart there. I had a really good one, and now it's gone. I guess how strict it is, right? Um, Maybe strict's the wrong word, but 504 is a little more broad. Yeah, whereas an IEP is a little more structured, and there's more steps, and there's more, I'm going to say red tape, but it's good red tape. It's, keep things in mind to make sure we're doing what we're supposed to be doing. So, all right. So now we've got a scenario I want you to think about. All right. So here we go. Imagine a student has asthma that causes them to miss school frequently, but when they are at school, they get straight A's without any special teaching help. Based on the previous slide, would this student likely fall under IDEA, requiring special instruction, or Section 504, requiring accommodations, and why? So I'm going to give you a couple seconds to think about it. And survey says this would be a 504 plan, right? Because if we're looking at the data, they're getting straight A's. So they don't need any change in how they're taught, or they don't need any specialized teaching. They need accommodations for their health, right? So they need things in place for their asthma. Now, with this is interesting because, yeah, I mean, if it was between the two, it'd be a 504, but actually now there are things called health plans. So, like in my school, all of our students who have like peanut allergies or asthma or something like that, that usually in the past had a 504 plan, now they have health plans. But in this scenario, it would be, it would be a 504 plan because we are making accommodations to support them. We are not having to change the entire learning environment. So the categories, there are 14 specific categories, right? There are 14 different things or diagnosis or whatever we're doing to use here. But these, and that's kind of an interesting stat. About 15% of public school students receive special education. So thinking about BG, we have about 2,000 students. So 15% would be about 300 students, give or take. So it's a good chunk. It's a big chunk of it, of the students. But here are four that you are really going to see a lot of. Autism, right? And, autism is its own category, affects communication and social interaction. Learning disabilities, that's a specific learning disability. This one is the most common. Um, there's a difference between high incidence and low incidence. The high is mild and moderate, and low is severe, multiple disabilities. ADHD. ADHD, depending, sometimes that could fall under a 504 plan. If we're looking at special education, that usually goes under OHI, other health impairment. And then emotional disturbance, inability to learn, regulate, not explained by other factors. So these are four more common ones that you will see that are under IDEA. So then, now that this is either brought to our attention, or we do a child find, or there is some sort of, hey, we want to take a look at this. What are the steps? So I want to walk you through each of the steps. Okay. So the first step is that waiting for the arrow to go. The child is referred as possibly needing services. So this can come from a multitude of ways. Parent reaches out. We have a concern. Um, Noticing trends, things like that. I will say, when if you are working in a school or you are communicating with the school, be careful the verbiage you use. Try to avoid putting in writing or saying, hey, I think this student needs to be evaluated for an IEP, for special education services, whatever. Because then that triggers things, and you have to do stuff. You have to do a lot of stuff. So again, I'm not trying to say I'm not trying to say we shouldn't or not do these evaluations, but just you want to pick and choose your words. Make sure you know that is the appropriate approach. That it's not, oh, maybe we should look at another you know intervention, because a lot of times, unless we have like specific directives from a parent, guardian, from community counselor, doctor, something like that, at least in my school, and that's all I can speak about, is we want to explore all the interventions we have available to the general education population. And then if it's still like, listen, we've thrown everything but the kitchen sink at this student, and they're still struggling in this area, that area. Okay, now we look at an evaluation. We look at doing a screening. But yeah, I'm not. Don't please don't mix my words in me saying no. Don't do it at all. Don't ever say that. Like, if you got a big concern, bring it up, but just make sure you choose your words wisely. And so then, child is evaluated in all areas related to the suspected disability. So yeah, when you bring up a student or a child, you don't just want to say, hey, I think this student needs special education services, or this kid needs a 504 plan. Go. Like, why? Right? Because if you think about it, there are 14. I mean, if we're looking at special education, there are 14 different categories under IDEA, and they can be vastly different from one another. So that's where you're noticing something. This is where you might be starting with that symptoms related to dot dot dot. And then step 3, qualified professionals and parents consider the results of the evaluation to determine eligibility. So you go through this screening process, you collect data, talk to teachers, and then again, never by yourself, as a team, you go through the stuff, and it's determined, are they eligible or aren't they? So I will tell you, with 504 plans, the calls to parents or guardians when they have brought up concerns about a 504, and you have to tell them, we don't have data that supports that. Those are fun conversations, let me tell you. All right, so then number 4, if they are found eligible within 30 calendar days, team needs to write an IEP for the child. So yeah, there's a little bit of a timeline there, right? We don't just want it sitting in limbo. We're like, okay, this is appropriate. Now what does a school day got to look like? Then obviously next you have the IEP meeting. Excuse me. After that, wait for these arrows to go away. The meeting's held and the IEP is written. And it's important to do it with the student and with the family there, so that you can get their input, so they take ownership in it. Make sure whatever they are noticing, that all their needs and concerns are being addressed and met. You obviously want data to support it, but make sure you're getting their input. And then once it's in place, it's not like, okay, that's it, we're done. you're going to provide the services, whether it be counseling minutes, whether it be, modifications, whatever modifications there are to the schedule or the learning environment, um, things like that. But you're keeping an eye on things, right? That you monitor the plan, and then step 8, progress is measured and then reported to the family so that they know what's going on. And then each year you have an annual review, right? Now this is just taking a look at things. Like if I'm looking from a 504 lens, because it's very similar to an IP, at least as far as what we do in the timeline and stuff like that. But if I'm doing an annual review, for lack of a better term, it's like a check-in. Hey, how are things going? These are your accommodations. Are they still appropriate? Are there any we should for sure get rid of? Are you noticing any other, gaps or areas in your, in the learning environment that are impacting you? And then every 3 years, you do a reeval. So that is when you're doing testing if you have to. That's where you're collecting data. That's where you're talking to teachers. If there's a counselor they're working with outside of school and you have a release signed, so you're talking to them, uh, and just making sure. Again, it's just it's these checkpoints to make sure everything's still appropriate with the plan. A couple important things: if you're going to do testing and changing schedules, like I told you at BG, we have the strategies class. Like parents have to consent to that. Parents or guardians. Sometimes they don't, right? Sometimes they don't, and then the IEP team uh, has to include a teacher, a regular ed teacher, special ed teacher, case manager, parents, uh, and us, counselor, at least school counselors too. And yeah, I mean, each school district's a little different. I will be completely 100 with you. Sometimes I get frustrated at our IEP meetings because I feel like I am just there to talk about their schedule and their grades in graduation. And there have been meetings where the case managers talked about all that, and they get to me, and I'm like, I got nothing. I don't know what you want me to say. Um, but yeah, like I said, with the IEP special ed, the rules, maybe rules is the wrong word, but like it's a little more kind of have do's, not could do's or should do's. So then our approach. So you want to shift from the legal compliance to like a human connection. Check your attitude, right? Just use student first language. Um, make sure you see that or person first. It's called not like, so for example, not the autistic child, a child with autism, right? Put the person first. The everything when you talk about the student, it doesn't always have to be about the disability. Like they're not a victim. This diagnosis, this IEP, the reason they have it is one small piece of who they are. So don't forget that. Strength based, focus. Don't just focus on what they can't do and why they have an IEP, but focus on the things they can do. Um, And then from our text, there was a quote, I have it at the bottom. Does my counseling help them solve their own problems? Does it help them feel better about themselves? Right. And I think I said this a couple classes ago when with anything you're doing with students, whether they are special ed, 504, whatever the case may be, am I acting with the student's best interest in mind? And if you can answer yes to that, you should be pretty good. So check your bias at the door. Check your bias at the door. So I want you to think about this. Since we're not meeting together, that's why none of these are group activities, just things to think about. Think about the term disability and be honest with yourself. What are some of the first images or feelings that come to mind? So just take a second. Okay. Now Now, think about one strength you have seen in a child who learns differently. How can you focus on that in a counseling session instead of their struggles? So, again, remember that a student that pity remind students that pity is often perceived as a condensate. Can't read that. I can't. I you know me and my typing, guys. I mess it up. But basically, just don't focus on strengths. Focus on what they can do, not what they can't do. Focus on what's the best that could happen, not the worst. What's the worst that can happen? So, I want to go through a couple of these different diagnosis we might have, or that we would, some of the more popular ones you would see with your students. So, emotional disturbance, right? This might be the most challenging population for us. Mental health diagnosis that impacts learning. A lot of times, these are students you'll see in schools with the most disciplinary referrals, suspensions, detentions. So, as it says up there, is associated with mental health or severe behavior issues over a long period that affect education. What are some of the types that go under this? Anxiety, bipolar, conduct disorder, eating disorder, OCD, things like that. Um, yeah. So what are some things we could do? CBT is really good with this, especially with anxiety and coping. I might have to work on social skills and conflict resolution, consistent limits and responsibilities. So just kind of providing that same thing to them every time they see you, knowing what they can expect from you. Which then leads us to specific learning disabilities. This is going to be the biggest population. About 36% of your students um, who are in special education who are diagnosed. They have a problem with input, organization, memory, and output. Some examples like dyslexia. They often feel like there's a gap between just what they can do in their intelligence and their achievement, right? These kids often feel quote unquote stupid because they understand that they are struggling. They just don't understand why. Some things we can do: social skills, solution focused counseling, right? The miracle question, art therapy, which then leads us to the miracle question. So we know about the miracle question, right? Solution focused, right? Perfect world, all that stuff. So I want you to imagine we have a student named Leo who hates reading aloud and acts out so that he can get sent to the office during English. So, how would you phrase the miracle question to Leo to help him visualize a better day in English class? I'll give you an example. Let's see if you could think for a second of a good example of the miracle question. So one example would be, hey Leo, let's say you went to bed tonight and somehow, you know, perfect world, your English class was perfect. You went, you did it, you left, you're like, that was a perfect class. What's the first thing you would notice that would be different? So that's one example, right? Perfect world. What's it look like? What's one thing you notice? Okay, how do we get there? Or what's getting in the way of that? And then we got our friends with ADHD. Remember that it is not a specific diagnosis. Like this falls under OHI, other health impairment. Um, This is a multimodal, right? Pills don't teach skills. Medication might help focus, but the counselor teaches how to organize. I like that, right? It's, you know, they might be on medication like, Ritalin or Adderall, but it's very like it makes me think too about so when I've taught the careers class and I talk about teaching it in schools, a lot of schools use different apps or programs or websites. So in my district, we used to use something called Naviance. Now we have shifted over to School Links. Where am I going with this? Because in there, it's important to emphasize that the products you use, the websites you use, are not the career counseling. They are just a tool for your career post-secondary counseling. Similar to ADHD, the medication is not the answer. It is a piece of the puzzle. It does support, it does help, but reminder, it is just one piece in everything with this multimodal. Yeah, I mean, you're definitely going to see students like this, and you're going to see different levels. Like I do have students with IEPs for ADHD. I also have students with 504s for ADHD. I have students with 504s for ADHD that are just protections only. I have students with ADHD 504 plans that have a little more stuff. So yeah, you're gonna get a little bit of everything there. So then we have our intellectual and physical disabilities, right? That you're distinguishing between cognitive and physical barriers, right? The intellectual, uh, yeah, this one's going to really be focused on adaptive skills, life skills, hygiene, and safety, or yeah, safety. And then you have our physical or health disabilities. These ones are the mind's usually not affected, but the body is the barrier. Um, one way you could look at it is sometimes um, when we're looking at intellectual disabilities, they're called the invisible disabilities because they're not straight in your face. Where the physical ones, like, okay, if I have a student who is, um, you know, paraplegic, they're going to be in a wheelchair. So you're going to be able to see, oh, there's that, right? They have a disability. I can see it. If a student, some of the other examples up there, if I see a student with the thing on the back of their arm for diabetes, or I see a pump hooked up, or I see a kid having to use an inhaler. Like those are physical. I see that. Like nothing really, for lack of a better term, that is impacting their functioning, their brain, but there is a major life function that's being impacted. Walking, digesting, breathing, things like that. Um, so yeah, it's you're gonna see a little bit of everything. Sometimes the intellectual ones sometimes can be a little bit tougher because, like I said, you can't always see those. You can't necessarily, like when you're in our world and you're around it, and you're hypersensitive to it. Like I could be talking to a student and I could know, yeah, they definitely have ADHD or they have OCD or they, whatever the case may be. But like to the general public, sometimes those students, they get a little more frustrated because, how do I want to say this? we might we might not factor in their disability because it's not so in your face like a physical disability is. I think that's how I want to say it. Yeah, I think that sounds good. Okay. So then you got to remember, like, it's not just the student. In case you didn't catch, this is the one image I did for this one that was AI. This one I think is pretty good. This one I don't think is so in your face like the other ones were for the other presentation where you definitely knew they were made differently. But yeah, I mean, you got to remember the parents, the guardians, the family, like they're going on this as well. Um, this first one is big. The loss of the perfect child. Now that might be a little harsh of a comment. Like I get that it's kind of like that. Oh, whoa, hey, no, 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 no. Again, this is just one piece of them. This does not define them. But from a parent's perspective, this can be a traumatic event for them. You know, it's almost like a grief cycle. They might cycle through denial or anger, bargaining. Um, I think one thing that I read in our text was counselor must validate the loss of the idolized child before parents can embrace the real child. Um, and then on page 700, it said help them process grief loss, empower them to see the child's potential, not just limits. Because I think with anything, and I could say this being a parent, um, I love my children. I don't think I have to say that, right? But I just said it anyways. But if down the road, either my daughters, it's determined they have a 504 plan, or they are special education, and for one way or another, like it takes a second, because sometimes unless you've been around it, you don't think like these families, they might not think like, no, not my child, my child's perfect, and all of a sudden, oh my gosh, they are not this this perfect being, but they still are. It's just look at the potential, not just the limits. Look at what they can do. Look at what's the best that could happen, not what's the worst. When I'm talking with my students, when we're looking at a 504 plan, if their parents are on board with it but the child might not be, I relate a lot of things to sports because that's how I think. But I'm like, did you ever play sports? And sometimes they say yes, sometimes they say no. And I'll be like, did you ever roll your ankle or something like that? Like my kids, that students that play basketball, they'll be like, yeah. I'll be like, did you ever wear an ankle brace for a while after that? And they go, yeah. And I go, okay, but why? Why did you just not wear one? They're like, well, my ankle was still a little tender, so I needed just that extra support. I'm like, okay. So you stopped playing? They're like, no, no. While I was injured, I was, but like when I came back, they're like, I just wore the ankle brace and I kept playing. And like, was everyone wearing an ankle brace? And they're like, no, just me. And I'm like, but you still got to play, right? And like they're looking at me with like these crazy eyes. They're like they know I love basketball, and they're like, wait, does this guy even know what he's like? Yeah, I played, but I was the only one with an ankle brace. Was it a big deal? And they're like, no. And I go, that's what your 504 IEP is. It's just your ankle brace. You are not worse or better. You are just need a little extra support. You have a rolled ankle. You need to wear an ankle brace. That's all it is. And that's sometimes how I explain it to parents too, because anytime, I'm sure those of you that have kids, we're accepting and we're good and blah blah blah. But like anytime, we get their report card, and my daughters are doing well, but if there is, it's weird because you think in schools or working in a school, I feel like I'm accepting, and I feel like I want my kids to be whatever they want, and I want them to just try their best, so whatever happens happens. But like if I get their report card and they have a bunch of exceeds, but they have one that is just meets, I might be like, huh. And that might stick out like a sore thumb, but there's nothing wrong with it. So that's a lot of times what these parents are. Man, I really went on a journey with that one, huh? That's a lot of time what you're having to talk to these parents about. Like, you know, this does not crush any dreams. This does not mean they're not going to be successful. This is actually a good thing because now we're going to provide the appropriate educational setting for them. So then that gets us to our next scenario. So you are meeting with a mother who just found out her 7-year-old son, or 7-year-old, excuse me, has autism. She says, I just don't know if he'll ever have friends or be happy. Instead of jumping in to fix this, think of one sentence that could validate her fear. So just think about that. And with this, you really want to just reflect on the emotion. You want to, you know, avoid what's called toxic positivity. Like, it'll be fine. That's not what she wants to hear right now. She kind of, even though you are not her counselor, it's a little mini counseling session. And what do study shows the most important thing in therapeutic relationship? Empathy. So Be empathic with her. Think of a sentence that validates her concerns, not validates that she's true, that she's right, but just validates why she's having those feelings. And I think, it's that old scenario, get more bees with honey than vinegar. So there's us. We have so many roles, right? Not just with these students, but with all of our students, but especially in supporting our children with disabilities. Advocacy, right? Advocacy. If we are seeing, I tell my students that I'm the case manager for their 504 plan. I say, I mean, I don't know. Maybe this is a good stance. Maybe it's a bad stance. Maybe it's just a stance. But like, if they have a teacher that is not providing their accommodations, I always ask them, like, hey, can you just remind them and see what happens then? I go, because I'm guessing 99 times out of 100, if you just remind them, they have, 145 students each semester. They might have just forgotten and they just need a friendly reminder. So try that. But if they don't want to try it, or if they do try it and the teacher still is whatever, that's where I come in. I got to fight. I got to support them and fight for their right, because I am their case manager. I am their counselor. And legally, that's what I have to do. Assessment. Now that, again, depending on your district, depending on how you work with, blah, 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 all that stuff. Like for us, I'm not really doing assessments. The social worker or the psychologist I'm aligned with is doing that. So you want to check with my friends going into school. You want to check with the school you're working in. But those you go into the private sector or community counseling, yeah, you'll be doing those assessments. Collaborate. If in a school it's easy. In those you doing mental health, you definitely would want to encourage the parents to sign releases. With and make sure it says on there. One tip I will give everyone here is that whether you work in a school, whether you're working outside the school, when you're doing a release, try to keep it specific but not specific, if that makes sense. Because what I mean is, like when I do releases with my students' therapists, and they send it back and it says for permission to speak with Brian Linhart, I always ask them to change it to say to work with Buffalo Grove Student Services Department. Um, so just in case I'm not available, or if caseload switches, or for some reason I don't work there anymore, don't want to have to jump through all those hoops again. So I would say when you're doing the release, if it's a student with a disability, if they are in special education, try to write one that says, if they were at Buffalo Grove, a release to speak with staff within the student services and special ed department, or staff that are a member of the student's IEP team, staff that are members of the student's 504 team, just so that, if things change, it's still covered, and you're not having to get a release for a counselor, for a special ed teacher, for a psychologist, for a social worker. Like, you know what I'm saying? So that's something to keep in mind. Direct services versus the indirect, like get that FaceTime with them. I know at BG, a lot of our students in special education, person-centered language, I almost messed it up there. They, like a lot of times if they have minutes on their IEP plan, are really, excuse me, I tried to hide that one. Our related service will service those minutes through a group setting, whether it be a DBT group or a social skills group, things like that. Sometimes it is one-on-one, but just, something to keep in mind too. Transition plan. In our school, our special ed department is amazing with this. Every IEP meeting, whether it is an annual review or a reeval, we're always talking about life after BG, and they have 3 big goals. They have 3 because they shifted over to this thing that's really cool, where the students make their own Google Slides presentation and they run the meeting. It's really cool. But on I think it's called Beyond BG. I forgot what the name of the slide is, but they have 3 sections. It's first one is what's their career. Second one is career they're interested in. No, 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 no. First one is always like what are their what are they planning after high school for like their living situation. Um, Second one is what career are they interested in, and then third one is if they're continuing their education or how they're going to get there. It's actually ever since they did this to where the students run it and they use this like Google Slides template and they get to throw in pictures of their family and stuff. These IEP meetings have become really the kids are more invested because they're creating it and they're just more interesting meetings. And then parent support, right? There's always feedback. There's a slide where the kids say, "Mom and Dad, do you have any questions?" We're always checking with them. Like after we'll go over something, like does this make sense? Um, our case managers will say, "Hey, before you came in today, were you able to look at the plan?" Because again, you want every person in that meeting to have a voice. And then this might be a record, 2 weeks in a row, a Mother Teresa quote. The miracle is not that we do this work, but that we are happy to do it. So just take a second and think about what is that saying, right? The miracle is not that we do it, but it's that we have the enthusiasm and that we keep coming back to do it. Because our job's tough, right? Our job's tough, especially if you're working with children. It's hard. It's really hard. So, reminder that when working with these students, we are an advocate, we are an assessor, we're a counselor, we're a consultant. We are putting on different hats all the time. But yeah, it's okay if when you work with your first client or student with a disability and there is paperwork and there's documentation and there's meetings and yeah, I mean, I'll be honest, this is my 21st year in education, so my 14th year as a counselor. Um, to this day, when I have students in our special education program come up to me to ask for a schedule change or something like that, I'm always just about always saying, "Hey, we got to talk to your case manager because they know the IEP plan. I don't. I don't want to do something illegal. I don't want to make a mistake." So, um, yeah, it's okay to kind of feel like you're walking on eggshells with this population because you care, right? That's really what it comes down to. So that is it. A friendly reminder, you have assignments for this week, but everything we are shooting for November 30th, right? November 30th, we want to be our drop dead date where everything is submitted, everything is turned in. I'll try to look at stuff that Monday. Just keep an eye on your emails in case I need you to clarify something or missing something. Please go through, do quizzes, check the assignments, all that stuff. And don't forget the course eval. Make sure you get a chance to get that in because I want your voice to be heard. I do take those seriously and I do review what is being said because, as I said in our first class, always a student, never a master. Once learning is over, then it's done. I do the same way. I always want to grow. And last but certainly not least, thank you. As I said, our last in person class, I have really enjoyed working with all of you. I have really enjoyed this has not been a term where I've dreaded coming to class. I will say I would have liked a little more participation. Maybe sometimes there were long, awkward silences when I would ask stuff, but I get it. I was always that student too. Sometimes when it was just like, I don't want to talk, I don't want the attention. Let's just go. So, this was a lot of fun. This was the first time I taught this class. I'm hoping, like I said, um, during our first class, my goal is that you left uh, this class with a little better understanding of what it's like to work with younger clients, younger students. Again, like the quote we had, I've referenced it a lot. I wish I remember what week it was, but it was when they said, you know, kids are not just little adults; they are their own subgroup, their own population. So, thank you. This was a fun class. I hope our paths cross again before you can graduate, but if they don't, best of luck with everything. If there's ever anything I can do to support you or help you out, please don't hesitate to reach out. And finally, oh, it's not letting me do confetti here. Boo. I was going to try to do, you can do the confetti here, but we did it. We're all done. 10 weeks done and dusted. Just make sure you get all that stuff in by November 30th. Have a lovely rest of your week. Have a lovely rest of your program. If I don't get to work with you again, have a good night. Bye.